Okay. Right. Well, thank you everyone for joining us for the latest webinar hosted by the Better Breathing Institute. I am Dr. Sabrina Bra, and today I'm joined by Dr. Mitch Lomax. Mitch is an associate professor in pulmonary exercise physiology at the University of Portsmouth on the south coast of England. She is also a KC's accredited sport and exercise scientist. Mitch has provided scientific support to several athletes, as well as Swim England and British Swimming and the England Pistol Shooting Squad. Mitch's research areas include breathing limitations during exercise and means to ameliorate them, including the use of respiratory muscle training and respiratory warm-ups. Mitch has a specialist interest in swimming physiology and has examined the occurrence and consequences of breathing muscle fatigue in swimming and the effect of inspiratory muscle training on swimming performance. Today, Mitch is going to be talking about how swimmers can harness their breathing muscles to improve their performance in the pool. There will be an opportunity for questions at the end of today's webinar, but feel free to add in the chat as we go along. Over to you, Mitch.
That's great. Thank you, Sabrina. Thank you for that introduction. Just a word of warning to anyone. I have a puppy and he's currently being exorcised outside, but when he comes back, there might be a bit of barking. So I'm going to apologize in advance if we get disturbed. But anyway, yes. So my name's Mitch. I'm absolutely thrilled to be able to have the opportunity to talk about two things that I'm very passionate about. So breathing and swimming physiology as well. So thank you for the invitation for that. Basically, what I'm going to do today in this webinar is kind of give a bit of a whistle-stop tour on why swimming is quite a unique sport with reference to breathing physiology, and also how the breathing muscles can limit swimming performance, and then also what we can try and do about that, and in particular how we can use respiratory muscle training and respiratory muscle warm-up to try and overcome some of those limitations. So that's kind of a flavour of where I'm coming from. I'm also going to focus on physiology. So I am a physiologist, so I'm not going to touch on psychology. I'm not going to touch on biomechanics. That's not because they're not important, but it's because this is where the research in this area really is really taken place. So to start with, I'm kind of going to give you an overview of, well, what is it about the swimming environment and water in particular that makes swimming challenging, particularly from a breathing perspective? And the first thing is that we undertake this activity in water because we're doing swimming, and the density of water is much, much greater than air. It's about 800 to 1,000 times denser than air, and actually that density also depends on the salt content. So if you're exercising in a water environment that has a much higher salt content, that's going to increase the density as well, which will make it easier to float, but it also makes it harder to move through the water. But I'm not going to go down the route of open water swimming in today's webinar. I'm going to focus pretty much on pool swimming. But that density increases the hydrostatic pressure, so the pressure and weight that we feel on our bodies. And what that does from a breathing perspective is that causes the chest and the lungs to be pushed inwards. Now, on land, when we're breathing normal air, typically our chest is trying to spring outwards and our lungs are trying to reduce to a smaller volume. But in water, everything's pushed inwards. Now, what that means from a practical perspective is that in order to get air into our lungs, our inspiratory muscles have to work a lot harder. So the work of breathing is actually much harder in water than it is on land. Now, logically, you'd think, okay, if it's harder to breathe in, surely that must mean that when we're breathing out, that hydrostatic pressure makes it easier. And yes, it does. But the problem with breathing into water is that hydrostatic pressure also narrows our airways. So as we're doing our expiration, and in swimming we tend to do quite prolonged expirations, we actually end up with an increase in airway resistance because of that airway narrowing. So we get an increase in the work of breathing because we're breathing against that hydrostatic load when we breathe in, but then we also get an increase in airway resistance when we're breathing out. So we get this kind of double whammy in terms of increasing the work of breathing. And then another key factor is we can't breathe when we want to in swimming. You have to coordinate your breathing with your stroke cycle. Probably the one exception to that is backstroke when your face isn't actually immersed in the water. So we have very limited breathing opportunities in swimming. So we've got a number of unique stressors, and I kind of ignored the cardiovascular effects of being horizontal and in immersion. And I'm going to focus just really on the breathing effects. Now, over time, that creates some chronic responses to training, which are beneficial responses. So when I say chronic, I just basically mean in response to swim training. So what we do see in swimmers is that they have better pulmonary function and higher lung volumes as well. So things like your total lung capacity, your forced vital capacity, your vital capacity. So in other words, the amount of air that you can maximally expire either forcefully or from a relaxed expiration, as well as your inspired volume as over 1 second, all increase in response to swim training, which is great. That's really, really beneficial for a swimmer. They can take more forceful breaths. Unfortunately, though, that chronic training also leads to airway disease. So we tend to see a much higher incidence of airway disorders in swimming. But that's not unique to swimming. So it's this chronic endurance training that swimmers engage in that over years of training leads to airway disorders. So it's not uncommon for us to see higher prevalence rates of things like asthma in swimming. And unfortunately, swimming does induce it, as does other chronic endurance activities. And basically, it's that repetitive chronic endurance training coupled with an unfavorable environment, and that unfavorable environment in swimming typically being swimming in chlorinated swimming pools, that comes together and increases our incidence of airway disorders. But I'm not going to go down a rabbit hole on that. I could easily spend an hour or so talking about that, but I won't. But it's not unique to swimming, is the point I'm trying to make. So we do get better lung function. That being said, we also see that swimmers are able to tolerate higher levels of carbon dioxide compared to other athletes. Now, this is really interesting because it's the CO2 that's going to drive your breathing. If you're not at altitude where you've got reduced oxygen availability, if you're swimming at sea level, it's that CO2 that's going to drive your breathing. And in swimming, because we have limited breathing opportunities, the longer we can go without breathing to some extent, the better. So we have to balance the need to get oxygen into the body with reducing the disruption to streamlining that occurs with breathing. So the more you breathe in swimming, particularly front crawl, the more you disrupt streamlining. So if you can reduce that drive to breathe, actually that means you're going to breathe less frequently, and as a result, you're going to experience probably less disruption to your streamlining. So this is why if you watch high level swimmers, if you watch sprinters, they will breathe much less frequently than the endurance swimmers. The endurance swimmers have got to get that air in. The sprinters, they just recover afterwards. So they will breathe less frequently. So if we can reduce that drive to breathe by improving our CO2 tolerance, that's great. Swimming training will naturally do that, but you can also target that by doing reduced frequency breathing or breath hold training. And a lot of coaches will employ this in their training schedules. So what it's doing is enhancing your CO2 tolerability. What it doesn't do is it doesn't create a hypoxic stimulus. So probably 10, 20 years ago, we used to think, oh, maybe that reduced breathing frequencies increasing your red blood cell count. That's not what it does. So it has a different benefit. We also see improved pulmonary diffusion capacity in response to chronic swim training. So that means our lungs can actually transfer more oxygen, which is a good thing. And also, swimming will increase our respiratory muscle strength because we're having to take big, deep breaths in and force that breath out again. If we're doing this repeatedly over lots of training sessions, we actually see a higher respiratory muscle strength in swimmers compared to other athletes. And another benefit that we get that's linked to breathing is improved oxygen extraction. So there's a lot of benefits that occur in response to training. Let's now look at the acute responses because it's these acute responses and breathing muscle fatigue in particular that's kind of led to people looking at how we can use respiratory muscle training in swimming. So if we look at the acute responses, well, one of the key things we see is that because swimmers have a limited opportunity to breathe, it changes their breathing pattern. So we tend to see a lower breathing frequency and a higher tidal volume. So in other words, swimmers won't take as many breaths, but when they do, they're taking a much higher lung volume. That means that they're inhaling much more forcefully and much more rapidly. So that causes the inspiratory muscles in particular to have to work harder than they would on land. Couple of other things we see in response to acute swimming. And when I say acute, what I really mean is when you're in a training session training. So a single training session is what I'm referring to here. We also see that swimmers actually experience hypercapnia and hypoxemia. So if we was to look at their blood samples, we would see they probably have too much CO2 and they have reduced oxygen content. And the reason for that is because we see reduced blood flow and a reduced alveoli ventilation, even though when you're swimming really hard, your metabolic demand goes up. So the negative of that is you're going to hold on to more CO2 and actually your oxygen content is going to go down. Now, you get that regardless of whether you're exercising at sea level or if you're exercising at altitude. So you don't only experience hypoxemia at altitude. So hypoxemia is not the same as hypoxia. If you're in a hypoxic environment, you are going to get hypoxemic, but you can experience hypoxemia at sea level. And this hypercapnia, this repeated exposure to high CO2, is why we get that CO2 tolerance improvement over time. And then the key thing really that I'm going to focus on and that underpins RMT in these athletes is respiratory muscle fatigue. We know swimmers get respiratory muscle fatigue. They get both inspiratory muscle fatigue, so IMF, and expiratory muscle fatigue, so EMF. And this is problematic. We see IMF in particular occurs in all swimming strokes, so butterfly, backstroke, breaststroke, front crawl. We see that it occurs over a range of distances, so 100 meters, 200 meters, 400 meters, competitive swimming distances. Typically, it's not been examined in longer distances. So it's not that it doesn't occur in longer distances, it's just that we've not really got round to looking at those longer distances yet. And something that's really interesting and sounds very counterintuitive is that the less we breathe, the greater the magnitude of fatigue, which sounds really odd because if you're not breathing as frequently as you could do, surely you're not using those breathing muscles as much. You're going to get less fatigue. And that's not what we see. So if we look at, say, a swimmer who breathes once every 4 strokes compared to breathing once every 2 strokes, they will experience more inspiratory muscle fatigue when they breathe less frequently. And the reason for that is because of this buildup in CO2 that we get. It's because we get this alveoli hypoventilation. So we're not breathing as much as we should do. And this can lead to respiratory acidosis, which then also has a knock-on effect on fatigue and potentially swimming performance. The other really interesting thing is that tumble turns alone can induce respiratory muscle fatigue, particularly inspiratory muscle fatigue. So even when we take out the swimming aspect and we just get swimmers to do tumble turns, we get respiratory muscle fatigue. And really interestingly, what we see is that inspiratory muscle fatigue in particular reduces the amount of time we can hold our breath during a tumble turn. It also slows the rotation time during that tumble turn, and we see that the swim out time from pushing off of the wall to actually getting onto the surface is also reduced. So swimming with inspiratory muscle fatigue in particular has a negative effect on our tumble turn performance, which is really interesting because normally we ignore turns when we do this kind of work. We ignore starts and we just focus on the swimming performance bit itself. And recent work from our lab has shown that actually we need to start looking at tumble turns when we're looking at this kind of work. Other things that breathing muscle fatigue will do is it will slow your swimming speed. You will swim more slowly if you have breathing muscle fatigue than if you don't. And it will change the way that you swim. So when we induce inspiratory muscle fatigue in particular to see, well, how is this affecting swimming? What we see is it increases breathing frequency, it increases your stroke rate, and it decreases your stroke length. So it changes your swimming characteristics in a way that is not beneficial. So rather than trying to maintain a nice long stroke length, we see that gets shortened. And it doesn't matter how good a swimmer you are, you will experience that. So we see breathing muscle fatigue from grassroots level swimmers right the way up to elite. So we've seen it in elite age group swimmers, in international swimmers, club swimmers, right the way through to master swimmers. So just because you might be an elite swimmer doesn't mean that you won't experience it. What's also interesting to note here as well is if we were to take a homogenous group of swimmers, whether they're international swimmers or club level swimmers, we would find that there will be some swimmers within that who don't suffer from respiratory muscle fatigue. And we see that not only in swimming, we see that across the board in different activities. So there is this idea of there's responders and non-responders. Some people suffer from it, some people don't, most people do. So this is really where the idea of respiratory muscle training in swimming has stemmed from. Because if we look at land-based research studies that tend to be a bit further ahead of swimming in this regard, what those studies showed was that in activities whereby respiratory muscle fatigue occurred, so cycling, running, even rowing, once we gave athletes respiratory muscle training, their performance improved. So this is why we then started looking at respiratory muscle training in swimming. And there's been a number of studies that have looked at this, not a huge amount. Some have just looked at inspiratory muscle training. Some have looked at respiratory muscle training. So they've included inspiratory and expiratory muscle training. And they've tried to get a handle on what is actually going on with RMT in swimming. Can it be beneficial? Should we be getting our swimmers to use RMT, so respiratory muscle training? So first things first, does respiratory muscle training improve respiratory muscle strength? And the way in which we look at respiratory muscle strength is we look at our respiratory mouth pressures. So our PI max is our maximal inspiratory mouth pressure. That's a surrogate measure of inspiratory muscle strength. PE max is a surrogate measure for expiratory muscle strength. Now, majority of the work that has been done has focused on the inspiratory muscles. There are various reasons for that. I won't go into them. If anyone wants to know why, please feel free to ask afterwards. But most of the work has actually looked at inspiratory muscle training specifically. And what we've seen is that inspiratory muscle training and respiratory muscle training does improve inspiratory muscle strength. Brilliant. We're really, really happy with that. And actually, if we look at the range of strengths that it affects, I'm just going to pull up my laser pointer. Bear with me. There we go. If we look at these two columns here, and we focus just on this first one, it doesn't seem to matter whether you have okay inspiratory muscle strength, so a value of around about 73 to 80, that's the low end of normal in healthy adults. It doesn't seem to matter whether you have that low level normal to pretty good strength, right the way up to really, 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 really good strength. So pressures of about 174, 185 centimeters of water. Those are people that have got really strong inspiratory muscles. Doesn't matter whether you've got really strong inspiratory muscles to start with or weaker inspiratory muscles, we see a significant improvement. So if we just look in our post column here and just look at where we see real at the moment, we can see we've got improvements following IMT regardless of actually the starting strength of those muscles, which is really, really encouraging. Now, the other thing that we tend to do when we do respiratory muscle training is we don't just give out what we call real respiratory muscle training or the intervention. We also try and balance that by having a sham or a control group. So we'll have another group of swimmers who will give them sham training. So training that we think actually this is not going to do anything to inspiratory muscle strength, or we'll have a control group. So a control group is just the group that they carry on only with their regular training. And what's really interesting, if we look at these two columns again, and some of you may have noticed this, is that look at what happens following sham IMT, and also what happens when we don't give people IMT and we just get them to continue with their normal swim training. We see that inspiratory muscle strength goes up. So we know that respiratory muscle training can improve inspiratory muscle strength, but clearly so does swimming training. And this is quite an important point because I think this is probably one of the key reasons why there's controversy over whether IMT in particular improves swimming performance or not. And it becomes a little bit murky when you're trying to look at studies and work out, well, is it beneficial? Isn't it beneficial? And part of that could be because swimming itself is very good at improving respiratory muscle strength. So before we move on, let's just have a quick look at the kind of training that people do. Now, this is a really busy slide. I know it's a really busy slide. I'm not going to read through it. What I've done is I've deliberately put on quite a lot of detail so that if you're interested in your own time in how you might undertake IMT and the type of programs that people have used, you can just come back to this slide and have a look. But to summarize it, we know that you can get improvements in inspiratory muscle strength in as little as 6 weeks of IMT. In fact, outside of swimming, when we've done land-based studies, we've seen it in as little as 4 weeks. There's no reason why that wouldn't be the case for swimming. And actually, the type of IMT that you do in our lab, we tend to do something called pressure threshold IMT, but there's various different types of respiratory muscle training you can do. And actually, most of the swimming studies have used the same kind of IMT as us. Now, what that means, pressure threshold IMT, is you have a device and there's a valve in that device. And that valve is set so that when you breathe in through it, the valve only opens and hence you get to breathe when you generate X amount of pressure. And we normally set that pressure to about 50% of your maximal inspiratory mouth pressure. So 50% of PI max. If you don't generate that pressure, you don't get to breathe. It's brilliant. You get instant feedback. So you only need to be loading those inspiratory muscles to about 50% of maximum for 6 weeks to see an improvement. And typically we'll do two sets of 30 breaths over 5 to 7 days, and we'll get an improvement. So that's the typical way of doing IMT in swimming, but there are other programs that you can use that also work. So we know we get an improvement with respiratory muscle training in PI Max. The big question is, does that translate to swimming performance? Yes, it does translate to swimming performance most of the time. So we know that 50-meter time trial performance can improve by up to about 11% following this type of respiratory muscle training. And I've given you the references there in case you are interested and you want to go away look at the papers. And in terms of the level of swimmer we're talking about, these are swimmers where pre-training they'll be doing that 50 meters, and this is front crawl or freestyle as it's more commonly known in the swimming world, of about 27 seconds up to about 40 seconds. So 27 seconds. I wish I could still do 50 meters front crawl in 27 seconds. I'm a little bit off of that at the moment. We also know that it will improve 100-meter time trial performance. And this improvement varies anything from about 2%, maybe up to 14%. Typically, the greater benefit occurs when you've got a swimmer or a group of swimmers of a lower level compared to the other swimmers. And again, if we look at the standard of those swimmers pre-IMT, they'll be doing 100 meters in about 64 seconds for the good swimmers, up to around about 112 seconds in the less good swimmers. But again, 112 seconds, I'd be quite happy with that as a 100-meter front crawl time. And we also see improvements in 200-meter swimming as well. So again, around about 1.5 to 14%. So we know that respiratory muscle training can improve 50-meter time trial performance, 100-meter time trial performance, and 200-meter time trial performance. And I think in all of these studies, they've used front crawl. So most of the work that's been done in this has been done in front crawl. Very little, in fact, I don't think there's any respiratory muscle training studies that have looked at strokes outside of front crawl. So there's a big gap there. As well as improving time trial performance, which normally is the key thing we're interested in, it also has some other benefits as well. So one study really interestingly found that over the course of 50 meters, so a 50-meter swim is a sprint swim. This is when you don't want to be breathing that frequently, because every time you turn your head to breathe during front crawl, you're disrupting your streamlining. So you just want to keep your head down. They actually found that after IMT, the number of breaths that swimmers took went down by 3 over the course of those 50 meters. And they also found that the time taken to the first breath actually increased as well. So swimmers were able to hold their breath for longer after IMT, which is, I find that really interesting because that's opening up a new avenue of swimming adaptation that we really hadn't thought that RMT might be able to influence. If we then look at submaximal swimming, so maybe the kind of swimming that you would do as part of routine training, we see that RMT can also be beneficial. And again, in particular, IMT can help to reduce your ratings of perceived exertion. So in a nutshell, it can feel as though you're not working quite as hard, which is nice when you're in the middle of a training set. It probably means you can push yourself a bit harder and hopefully get even more benefits. And another interesting thing, I found this quite interesting, is that a group of swimmers after this was RMT, not IMT, but after RMT on land were able to expand their lungs to a greater extent, which is quite interesting. So respiratory muscle training does improve swimming performance. Great. But, respiratory muscle training doesn't improve swimming performance. This is getting quite confusing. So again, if we look at typical swimming distances 100 meters, 200 meters, 400 meters. They're all time trial events that swimmers compete in. We found, particularly in our work, that while inspiratory muscle strength goes up in these swimmers, that doesn't translate to an improvement in swimming performance, specifically in age group swimmers who are undertaking relatively high volume training. And I'm going to come back to this in a bit because I think this is really what's behind the controversy that we're seeing. So we've shown you can get an improvement in inspiratory muscle strength, but actually that doesn't always lead to an improvement in swimming performance. Likewise, 400-meter swimming time trial, another study found that actually performance wasn't improved. Interestingly, with this study, the same authors found that 100-meter time trial, 200-meter time trial was improved in these same swimmers. It was only when they did a 400-meter time trial that there was no effect of RMT. IMT specifically in that case, which is really interesting. And then the only study that I'm aware of that's looked at a longer duration is a 3,000-meter time trial. Now, these authors found that basically they had two training groups. So they had one training group who were doing what they would call high volume RMT, and another training group who were doing more low volume RMT. And they found that actually there was no statistical improvement in 3,000-meter time trial performance, but they found an improvement of 17 seconds in those doing the high volume training and 44 seconds in those doing the low volume training. I would argue that's meaningful. Forget whether that's statistically significant or not. As a swimmer, if there's any coaches on the line, if you see improvements of that magnitude, in my mind, that's a meaningful change, even if it's not statistically significant. However, we've also seen in other studies that peak swimming velocity, or speed if you like, is also unchanged following RMT. And the speeds at the lactate threshold might also be unchanged. Lactate thresholds are really sensitive to training. So you might have heard of VO2 max, the gold standard measure of aerobic fitness. The fitter you get, the less likely your VO2 max is to change. And actually what we tend to see in really, really well-trained athletes is their VO2 max doesn't really change, but they still continue to perform better. And that's normally because we're seeing improvements at the workload associated with the lactate threshold. So these are really sensitive to training adaptations. But this study found that actually RMT doesn't improve that. And the final one, I find this one quite interesting. This is a study where the authors got their swimmers to do 200-meter time trials, and then they converted that to FINA points. And they had two groups. They had their swimmers who were doing the real IMT, so the intervention group, and then they had a group of swimmers who just carried on with their usual swim training, the control group. And what they found was that actually both groups improved their FINA points, but interestingly, there was no difference between the control and the real group in terms of how many FINA points, not from a statistical perspective. And again, I think this is coming back to the idea of swim training itself is able to improve PI max, and that could translate into improved swimming performance more than IMT or RMT specifically. So what is going on? This is really quite confusing. You look at the literature, there's clearly controversy. We can clearly see that IMT and RMT can improve inspiratory muscle strength. Sometimes that leads to an improvement in performance. Sometimes it doesn't. What do we do with that information? Well, if we go back over those studies, competitive level and training volume appear to be really key factors. So if we look at the studies where that increase in PI max, so increasing in inspiratory muscle strength, was associated with an improvement in swimming performance, we tend to see that the swimmers undertook a relatively low weekly training volume. And actually, we're looking at less than about 34 kilometers per week of training. For age group swimmers in particular, that's probably quite a low mileage. For master swimmers, I would argue that's not a low mileage at all. But it seems to be that if you're doing less than 34 kilometers, that improvement in MIP or PI max, sorry, doesn't necessarily translate over to swimming performance. So we can see that if we look at these studies. These final two down here, unfortunately, we don't know the training volume of the swimmers used, but it's really unlikely that they would have been doing more than that, given the fact that they were using club level swimmers as opposed to kind of elite national or international level swimmers. And also with this final study, their swimmers were only doing 3 sessions a week. So the likelihood of them exceeding that is pretty slim. If we then look at the studies whereby we didn't see that improvement in PI max translating to improve swimming performance, we see that they used a much higher training volume. So we're looking at training volumes of around about 41 up to 88 kilometers a week. I mean, that's just crazy. 75 to 88 kilometers a week of swim training is a hell of a lot of training. So there seems to be this kind of threshold, this threshold there. You'll notice there's a star here. The reason there's a star here is because in Kilderlin's study, this was the study where 100 meters and 200 meters performance improved, but 400 didn't. And I'll come back to that a little bit later. So we clearly have got a threshold phenomenon going on. However, we need to be cautious about that because I think it's very unlikely that there's a threshold volume per se that means if you do less than this, you're going to get a benefit in swimming performance. And if you do more, you won't. It would be lovely if it was that clear cut. Physiology is very rarely clear cut. So what's probably happening is it's the other changes associated with those training volumes that are allowing that increase in PI max to help improve performance versus it being swamped or masked by the swim training itself. So what is it then that we think is affecting the efficacy of RMT in swimmers, and what do we need to consider? Well, I think the first thing is we do need to consider those high training volumes. We already saw earlier that swim training alone can increase PI max. Inspiratory muscle training will, respiratory muscle training will, but so can swim training, and so can swim training. And it might be that if we're doing high volume swim training, that simply swamps any benefit that or any additional benefit that IMT might provide. So it could be that it's masking any benefit from the IMT per se, which we are able to see in swimmers who are doing a lower training volume. Other things we need to consider are the training cycle phase. If we look at the RMT literature, particularly in swimming, it's full of one-off training programs. That's not how we train. We know that. There's a whole science, a whole periodization underpinning how we undertake exercise training. And at the moment, we haven't really cracked how we do that in swimming. So we need to think about when do we prescribe RMT, in what training cycle phase are we going to see the greatest benefit? Is it worth doing it when swimmers are in a high volume phase? Or actually, would it make more sense giving swimmers this training when they're in a lower volume phase and maybe trying to boost the strength of their respiratory muscles to make them more resilient for their normal swim training? We don't know the answer because it's not something that's been looked at. There might also be a threshold for IMT efficacy. So it might be that the intensity and duration are linked in some way. And this might be behind why we saw improvements with the 100 and 200-meter swims with one of the studies, but in the same swimmers, we didn't see an improvement in 400 meters. So this might be something else we also need to consider, not only training volume, but it could be the swim itself. It might be that we need a certain intensity before we get IMF, EMF, and therefore before IMT and RMT can have a beneficial effect. And it might be that maybe the longer durations aren't long enough to see a benefit given the lower intensity that we're working at. Another key thing, and this is something that I feel quite strongly about, is how we're delivering the RMT. So are current practices suboptimal? My gut says yes, they are suboptimal. Basically, what we've done in the RMT world, particularly in swimming, is we found a protocol that works and we've stuck with it. And we've gone, this protocol improves inspiratory muscle strength. Let's just work with this protocol. And I think it's highly unlikely that we've struck gold first time. So I think we really need to go back and reevaluate how we're administering RMT to our swimmers. And I think if we change it, I wouldn't be surprised if we start to see more benefits coming through, particularly in those swimmers that are maybe already doing high volume training, because I suspect we're not targeting those muscles in the best way possible. And then other things we need to consider, anthropometrics, we need to consider age. Have we got responders, non-responders? If we look back over the swimming studies, we've got a whole different range of ages there. And we don't know whether some of the benefits we're seeing, particularly in the age group swimmers, happen to coincide with a natural maturation in lung growth. So we don't actually know how much of this could be due to natural maturation in our age group swimmers versus the intervention itself. So again, we need to dig a bit deeper to try and work out how can we enhance the efficacy. And another thing to consider is actually, do we see differences with novice versus experienced swimmers? Because the way that novice and experienced swimmers breathe, swim, coordinate is very different. So what you see with novice swimmers is they will manipulate their arms to facilitate breathing. Not what you want to happen. A more experienced and better swimmer will manipulate their breathing to limit propulsive disruption. That's how you get good at swimming from a breathing perspective. So it could be we've got a bit of a curveball going on here, and it could be that maybe RMT could be really useful with our less experienced swimmers to try and help them control their breathing a bit better so that they can manipulate breathing to limit propulsive disruption rather than the other way. No one's looked at that, but I think that's an area that we need to look at. So with all those things in mind then, who might benefit from respiratory muscle training, and what are the future things that we need to look at? Well, I think fundamentally, if we look at the swimming RMT literature today, it appears that those who are doing less volume training might see the greatest benefit. So children, always slightly problematic because you don't want to be overloading those too much. They could benefit. Maybe those swimmers who are returning from injury or absence, they haven't done as much training as they wanted to, or those who have limited opportunities for swim training for whatever that might be. And also master swimmers. Master swimmers are very good swimmers, but they don't do anywhere near the training volume of age group swimmers. So it could be that they're missing a trick. And if we did RMT in those group of individuals, they might be even better than they currently are. Another slightly oddball one is backstroke swimmers. This is an interesting one. If you spend most of your time doing backstroke, your face is not in the water as much as someone who's doing front crawl or prone swimming. So backstroke, you're supine, butterfly, breaststroke, front crawl, you're prone. So backstroke swimmers theoretically are going to experience less breathing restriction. So does that mean that they're not getting the same natural benefit from a breathing perspective as other swimmers? Don't know. I've just thrown that out there. It might be that no, that's not the case, but no one's actually looked at that. The other thing, as I alluded to before, is how do we integrate RMT into swim training? There's been no studies that have done this in swimming, which is amazing. We tried it a few years ago and it just didn't work. We couldn't get the swimmers to stay in the program for long enough. But what we do know from land-based or terrestrial exercise studies is that when you stop doing IMT, because it's IMT that's been looked at in these studies, the benefits that you get to inspiratory muscle strength and exercise performance reverse. So just like regular exercise training, you can't be doing this as a one-off for long-term benefit. But we don't know how to best integrate RMT for those long-time benefits. And following on from that, we also tend to use a one-size-fits-all approach, which to me is a bit ludicrous. I'm guilty of doing that. I'm very guilty of doing that, but I'm very aware we probably need to move beyond that. So we need to look at individualizing breathing muscle training programs. And this also includes looking at, do males and females need to be trained differently? Because male and female lung anatomy and physiology is not identical. There are differences. So it might be we need to train males and females differently. And then lastly, we also need to think about the type of breathing muscle training we're doing. When do we just do IMT? When do we maybe just do EMT? When do we look at combining IMT and EMT, so inspiratory muscle training and expiratory muscle training, into respiratory muscle training? And we haven't done that yet. So there's lots of future directions there, lots of things we need to look at to work out how we maximize the benefits of RMT. And my final slide is, don't forget about a breathing muscle warm up. You can use the same devices to train your breathing muscles to get those structural adaptations, those more long-term adaptations. You can use those same devices to warm up your inspiratory muscles. And there's been a handful of studies, this is really neglected in the swimming world, that have looked at what happens if you combine an inspiratory muscle warm-up with your swimming warm-up, and it's all good. We see a transient increase in inspiratory muscle strength, and more importantly, from a performance perspective, we see that that does translate to improved swimming performance. So we see 100-meter swimming times are improved, and we also see that 200-meter swimming times are improved when you combine an inspiratory warm-up with your kind of standard swimming warm-up. And briefly, the final thing, how do you do that? It's very, very similar to how you do breathing muscle training, pressure threshold breathing muscle training. Typically, you'll do 2 sets of 30 breaths at 40% rather than 50% of your maximal inspiratory mouth pressure. And we know that that will increase your MIP transiently, and that appears to translate into swimming performance. So that's my whistle-stop tour of breathing muscle limitations in swimming and how RMT might lead to improvements in performance, and reasons as to why it might not when we see that it doesn't lead to improvements. So thank you for listening. If anyone's interested, at the end of this, I have also got a list of references. So if you really want to delve into this and do some reading, I've given you those references there. I'm going to be quiet now and let Sabrina take over.
Thank you, Mitch. I thought that was brilliant. You've left us with a slight conundrum. Although as somebody that swims less than 34 meters per week, kilometers, sorry, per week, I feel like maybe I might benefit from some IMT. Um, if anybody would like to put any questions on the chat or on the Q&A, please feel free. There's one already. I just wanted to start off. You mentioned a lot about how most of or all of the studies have been on people doing front crawl.
Mm.
Is there any, or is there in the literature, do they mention in terms of the training with or RMT training, the position of how they're doing the exercises? Because obviously swimming is very unique from that point of view. Does that have any impact?
And this is kind of what I was alluding to, Sabrina, when I said I don't think we're doing this right. I think we could see much better or more benefit if we try and do more functional RMT. So we actually link it to what you do in swimming. Because if we think about swimming, you're doing those very rapid inhalations and exhalations. You've got the pressure on your body. Your breathing muscles also aren't only just being used for breathing, you use them for propulsion in swimming as well. You can't replicate that by doing a non-pool based IMT program. So what you typically do is you sit there with the device, you load it, and you take those big deep breaths. Great, that does work, but you can't replicate the muscle movement, the actual lung volumes that you get during swimming. So I think this is probably where we need to move away from the let's use the approach that we've traditionally used on land, which is we do all our RMT on land, and actually let's start being a bit creative. And I've got various ideas about how we do that. So in the literature, for the swimming literature, no, they've all done it pretty much the traditional way. When they've given someone respiratory muscle training, it's that typical land-based protocol.
Okay, brilliant. Thank you. There's a very specific question that you may or may not be able to answer. Somebody said, which device do you recommend for training the inspiratory muscles?
Yeah, that's a loaded question, isn't it?
Yeah.
I've used a few, so I've used a number. All of them are commercially available. I have to say, I am very fond of Power Breathe. They give you a lot of versatility. There's a lot of different models that you can use. You've got your kind of more affordable ones. So the classic models that I think were the first ones Power Breathe brought out. I think you can get them for like 20, 30 pounds. They're
Mm.
brilliant. They're really robust. If I'm working with young kids, those are the ones I tend to give them because it doesn't matter if they fall on the floor. It doesn't matter that they drop them in the swimming pool that they're invariably going to do. It really doesn't matter. You've then got your much higher spec models that have the electronic valves that give you a lot more control. But if you drop those in a pool, you're going to know about it because that's going to be expensive to replace. So I am a fan of Power Breathe, but I have used other devices as well. There's a lot out of there. There's a lot of devices out there, and most of them will give you benefit.
Mm. And as you say, you specifically use, or a lot of these studies have used pressure threshold.
Yeah,
Um, there are other devices as well
yeah,
on the
yeah,
market. Somebody has asked about the training protocol,
yeah.
what you think is best. They said, is it, for example, twice a day, 30 breaths, and for how many days? Again, you did allude to this being something that we perhaps don't know the answer to.
Yeah, I think what we know works, but this doesn't mean that it's the most optimal. And I would suspect it's not the most optimal, but we need to do studies to work out what is. We know that those kind of 30 breaths twice a day will increase your inspiratory muscle strength. Now, the way that we tend to do those is where we can, we will try and do one set of a morning, one set of an evening, just to try and give your muscle some recovery. The study that I've recently finished with one of the swimming clubs with age group swimmers, the coaches quite rightly said, Mitch, if we leave it to them to do on their own, they're not going to do it. So what their coaches did is they actually integrated it into training. So they had a period on their training sessions where they said, right, you're now going to crack on and do your IMT. So you can do it all in one session, but you might just get a bit tired. I don't think it's going to make much difference in terms of, are you going to get more benefit if you combine them versus if you leave them, if you have one of a morning, one of an afternoon. I really don't think it's going to make that much difference. You might just find it more tiring if you do it all in one go, but depending upon if you're doing it as an individual versus if you're a coach and you're administering it, it might be easier to get all your swimmers to do it at once. It kind of comes down to really who you're working with and how much you trust your swimmers to do as they're told.
Often we advise, or I've certainly found, and from my experience, people have to start doing slightly less, just because,
Yeah,
as you would with any exercise,
yeah,
you've got to get used to it, get the technique, and it's really quite tiring. And
yeah,
then you can build up to that 30
yeah.
minutes.
I think that's a really good point, Sabrina. When I've worked with clinical populations, so I've done some work with COPD patients and asthmatics, we have the end goal being get up to 50%. So
Mm,
we start much lower and each week we build up. What I tend to find with athletes is you can go straight in at 50%
mm,
with the athletes I've worked with. But what we tend to do is each week we'll increase the load because you adapt quite quickly.
mm,
So there's a couple of ways you can do that. If you're doing a research study, you can actually get your swimmers back to the lab, or you can go to their training sessions and you can adjust it for them so you can check it's opening at the right load. The more practical way of doing it, and this works, this is what we do in most of our studies, is we say each week increase the tension, and you want it so the final 5 breaths of those 30 are feeling progressively harder. So
mm,
by the time you get to breath 30, you're thinking, do you know what? I'm done. I just need to stop now. That's the approach we tend to use, particularly if we're using age group swimmers where you want to go to them rather than them come to us, and that works.
mm. And I suppose, and I know that we have a lot of physio colleagues that would probably want me to say this, but as long as you've trained them and the technique is right, and they're not, people aren't exacerbating a breathing pattern disorder, actually, like weightlifting, or however we kind of assimilate
Yeah.
RMT, that's what you're trying to achieve at the end, isn't it?
Yeah, and that's a really important point. So before we allow any of our athletes, whether they're swimmers, athletes, clinical populations, to go away and do their RMT, we train them how to do IMT first. So it's only once they've done some sessions with us and we go, we're now happy for you to go and do it, do we then give them the device and go away and do it? Because there's a tendency, you're basically putting this device into your mouth and you're doing big deep breaths in and big deep breaths out.
Mhm.
And soon as you give someone a mouthpiece, they will start to
Yeah.
hyperventilate. And it's really, really important with RMT that that doesn't happen. So what we tend to say, or what I will say to people is take a big maximal breath in, take a nice big maximal breath out, and then pause and wait until your natural urge to breathe tells you to breathe, and then you breathe. So it's probably about a 2 to 3 second pause, depending on how good your CO2 tolerance is. But yeah, it's really important, don't hyperventilate,
Mm,
because if you hyperventilate, I guarantee you're going to go vroom on the floor and pass out.
yeah.
So yeah, you've got to have controlled breathing. It's not rapid, forceful, get through this as quickly as possible.
Hmm. And without opening a can of worms, obviously the tendency to use any of your accessory muscles, neck, I mean, that's not IMT. You're verging on different territory there.
Yeah,
Um, sorry.
yeah, yeah. I see what you mean by can of worms. I guess as a working in the swimming world and as a swimmer, yeah, you want to target those muscles as well
Yeah.
because those muscles are really key in breathing, but they're really also really key in propulsion in swimming. And it's one of the reasons that we think is behind why we see such a high magnitude of breathing muscle fatigue in swimmers and why it occurs so quickly compared to other sports. And we think it's because of that duality of muscle function. So your breathing muscles aren't only helping you to breathe, they are actually responsible also for helping you to move yourself through the water.
Mm, okay. There's one more question.
Hmm.
I could start on EMT, but I won't because I think you've got to go walk your puppy. But somebody, again, along the same lines of position, somebody has asked, would you recommend sitting down, standing, or performing IMT prone with prone on your belly on a Swiss ball? That's what they've asked.
That's a really good point. I guess for safety, I normally say do it seated, and that's purely a safety thing. So that if you do end up breathing a bit too frequent and you start to get lightheaded, you're already sat down. You're less likely to actually fall over and do yourself injury. So all that's going to happen is you're going to slide off a chair rather than if you're standing and you pass out because you've been hyperventilating, you could do yourself more damage. So from a safety perspective, I would say do it seated. From a functional perspective, go for on a ball being prone. This is something I really want to look at. So if we've got people on here that are thinking, do you know what, we want to do some of this with our swimmers, feel free to get in touch and we can have a chat about actually what might be the best way of trying to maximize the benefits. But as I said, there's been so little done in this in swimming that we're really just starting on the journey of, well, how do we optimize this? So we need to look at all different ways of doing it to see what gives us the best benefit moving forward. And that might change depending upon the swimmer and depending upon where that swimmer is in their particular training cycle as well.
Mhm. Um, are you okay to do one more question?
Yeah, yeah, that's fine.
It was just because somebody has asked if you would combine inspiratory and expiratory muscle training, or which one do you prioritize over the other? You sort of talked about it today, I think, but see what you say.
Yeah, I do believe expiratory muscle training works. I am an advocate of expiratory muscle training, and I have to say I was thrilled when Power Breathe actually brought out an expiratory muscle trainer as well. What I would say is you've got to be really careful how you do it. So I have done RMT studies in the past, and what we did was we didn't do IMT and EMT in the same session because actually if you're loading both your inspiration and your expiration, it can actually be too much. So the way that we've done it is we did say the first set IMT, so you can breathe out normally, and then that next set of breaths we did EMT so that you could breathe in normally. I think especially when you're just starting out on an RMT journey, you don't want to be overloading yourself too much. So my advice would be if you're going to do both, don't automatically combine them. Start with IMT or EMT and then change over. But again, I think there's been one, maybe two studies, not even in swimming, that have looked at IMT versus EMT and which is better. I think IMT, you may be more likely to get benefits with IMT because inspiration is always an active process. Expiration isn't always an active process, and actually it's aided by the relaxation of the inspiratory muscles. But in swimming, your expiratory muscles are absolutely crucial for stabilizing your body and for tumble turns. And we know that expiratory muscle fatigue is linked to poor tumble turn performance. So we've shown that in one of our recent studies. So I think we need to be doing both. I don't yet know what's the best way of integrating those two so you don't end up damaging or reducing the effects of one because of the way you're doing the other.
Hmm. And that I think that's why I've often I generally tell people for that reason you do them separately.
Yeah,
Like again, any other weight training, doing one at a time and
definitely.
doing it properly to get the maximum benefit that you can.
Yeah, yeah,
Brilliant. Well,
definitely.
I look forward to your update then in a year's time, Mitch. You've got a lot of research and future research projects that we could talk about. Thank you so much
Brilliant.
for your time.
Thank you. It's been a pleasure.
Yeah, it's been brilliant. And yeah, I hope that your puppy behaves tonight. You have a good
Well,
evening.
I'm going training. So at the
Oh,
moment he's quiet, going to do a quick walk. I'm going training. My partner's going to deal with puppy. So I'll be fine. I'll be fine up and down in a swimming pool. But there might be
brilliant.
chaos when I come home.
Well, have fun. Thank you so much, Mitch. It was lovely to
You're
see you.
welcome.
Thank you.
Thanks.
Have a good evening.
Bye-bye.
Bye. Bye-bye.
Bye-bye.